Hi Year 10, it's Miss Rowe, and I'm just going over the P3 again from yesterday's lesson. So here we go. So let's start. So you need to understand how health and social care services are accessed, and this is P3. So service users gain access to the services they need in different ways, and we went through, can you think of an example? So making an appointment with your doctors or GP, being taken to A&E by paramedics, sent by GP to see a hospital consultant for tests. For example, someone said yesterday that they'd just been referred to a physio. This is called a referral. So that's an example of it. So I've got over here the keywords. So that is a keyword. So service users just means an individual who accesses a health or social care service, like you and me. Okay? Next, types of referral used to access health and social services. There's 4 referrals that we're going to look at. So self-referral, me phoning the doctors, going to the walk-in centre, for example on Whitegate, making a dentist appointment, going to the opticians for an eye test. So there's some examples of self-referral. Next is professional referral. So a GP sending you to hospital for an x-ray. So if you've, fractured or you think you've broken something and you go to your doctors just to double check it, and then they send you or refer you to the hospital for an x-ray and give you like a little form that you have to show. Making an appointment for you to see a consultant. So again, you might see a consultant about, say you've got an issue with your nerves and need to see a neurologist. Then the GP will make a referral for you to see the neurologist at another venue or another hospital. So that is an example of professional referrals. Compulsory referrals. This is for child taken into care by a local authority because they are at risk of abuse. So children in care, for example, might get referred to by the local authority, also known as the council, or it might be the social services, etc. They will refer them because they're at risk or been abused. An adult with serious mental health problems taken to hospital against their will because they're at risk of hurting themselves or others. So again, that's a compulsory referral because the GP or the local authority that is concerned about that individual, that they might hurt themselves, so or other people around them. So that's when it's compulsory. So they have no option to go to the hospital, etc. Third-party referral. Right, so for this one, you've got to think of, say you're a neighbour, you're a bit concerned about a child living nearby, so you think that they might be getting hurt at home or they look malnourished, then you would be the third-party referral. A friend telling someone about the voluntary group or charity that can advise them about health and social care services. For example, I might say to you, oh, there's a new centre on Whitegate Drive and it's called Disability First. So someone in your family you might know, or a friend, if they are disabled, you can tell them about this voluntary service. So that's an example of a third-party referral. A relative making a GP appointment for an elderly parent who's getting confused, so or not eating properly. So, for example, there's someone in my family who's got dementia and Alzheimer's. So we had to call the GP and make an appointment for them because they kept getting really confused. They were walking around Poulton and not knowing what they were doing. So we had to ring for a GP because they couldn't. So that's that shows the third party. So sorry, I've just made a few changes because I noticed I hadn't done it properly. Okay, so here we go. So self-referral, professional referral, compulsory referral, and third-party referral. So these are what you need to look at. So understand how health and social care services are accessed. That's P3. Yesterday, you were finishing P2 and you need to start P3 if you were catching up or you've missed lessons. Okay, so we should be on P3, finishing off P3 by next lesson with Mrs. Tyson. Okay, thank you.